Dr. Ciro Sumaya, the founding dean of the Texas A&M School of Rural Public Health, realized early in his life that pursuing excellence in education was key. Graduating as valedictorian from Brownsville High School, he went on to complete a medical degree from UT Medical Branch in Galveston and a Master of Public Health in Tropical Medicine at Tulane University. He served on the faculty at UCLA and later the UT Health Science Center in San Antonio, where as Associate Dean of External Affairs, his career focus began to change.
I went from assistant to full professor, and that was really based on credentials that I had in medicine. Then I decided to make a transition and started exploring things that connected the universities with the communities that they serve. And this was now the era of the public health interest in activities that I started doing, one of which was developing an area health education center sponsored through the federal government.
In 1993, Dr. Sumaya was asked to participate in the task force on national healthcare reform, headed by then First Lady Hillary Clinton. Soon afterwards, Dr. Sumaya was asked to lead HRSA, the fifth largest federal health agency with a $3.5 billion budget and 2,200 employees nationwide.
This agency, the Health Resources and Services Administration at the federal level, oversaw a myriad numbers of health programs that related to public health issues. And so decided to make the move and leave San Antonio, go to Washington, was there 4 years. I think it was a fascinating experience of where you see where academic institutions relate to, positively or negatively, with academic health centers to help the community that they surround and improve health overall.
By his side has been his wife Carmen, who became so interested in her husband's work in public health that she completed a master's degree of public health at Johns Hopkins University while they were in Washington, D.C.
It's been fun, going to different places and meeting people and people that are just as, passionate about public health and making a difference in the community.
Meanwhile, back in Texas, Texas A&M University was in the beginning stages of the formation of a new college of public health and in search of a leader to build a college from the ground up.
It takes a champion at the top for a school to be successful, for a program to have credibility, and for the courses to be relevant. And so it was those things that we were looking for. And Dr. Ciro Sumaya was finishing part of his work in Washington at HRSA, and perhaps keeping an eye toward Texas. And A&M, in its wisdom, was able to secure Dr. Sumaya for this very important job as dean of a brand new entity, the Texas A&M School of Rural Public Health.
In April 1998, the Texas Higher Education Coordinating Board approved the granting of degrees by the school. 5 short months later, in August, 23 very brave students started classes. Dr. Barbara Quirum was the first faculty member of the school and remembers the excitement of the early days.
Our students were remarkable. They were so excited to be part of this new adventure.
It was a very unique experience, and looking back, I don't think we realized how unique it was that all of our faculty knew all of us. And not just by name and not just by what we were studying, but they knew who we were, where we had been, where we were coming from, what our interests were. It wasn't unusual for us to decide to grab lunch because most of our classes were in the evening. A lot of us were graduate assistants during the day in the office, and we would grab lunch, and there was one restaurant in particular that we loved, Nipahat. It was a little Thai restaurant down on Northgate, and Dr. Sumaya loved Nipahat, and he would either go with us, or if we were ordering it in, he would put his order in and come sit down and talk with us during lunch. So we had a lot of interaction outside of the classroom, a lot of interaction being part of developing a new school, getting our ideas and feedback that I don't think I realized at the time how important that was.
And then one day, Dr. Sumaya called me into his office, and I'll never know what sparked that call or that discussion, but it forever changed the course of my life. He asked me, he said, "What do you think of Washington, D.C.?" And I remember telling him, well, I've never been there. I've never been to Washington, D.C., but I've heard great things. And he said, well, what do you think about trying to do a practicum out there? So I was initially going to be there for 10 weeks. And this May, it'll be 15 years that I have been in Washington, D.C.
In May 2004, the school received a full 7-year accreditation by the Council on Education for Public Health. This accreditation was completed in record time for a school that did not have a preceding public health degree program.
We requested a full 7-year accreditation the very first shot, and we were successful with that and extremely proud of ourselves.
Classes were taught in multiple locations until January 2006, when a new 3-building complex was completed on the A&M campus to house the school. An additional smaller building was then purchased in partnership with funds from the City of McAllen as another example of an academic community partnership.
Dr. Sumaya just deserves so much credit for really building the school from the ground up and making it to a first-class institution. And one of my best memories of Dr. Sumaya is he invited Harrison Spencer, the president and CEO of ASPPH, and I to the groundbreaking, the grand opening of the school. And it was held in an unfinished space, and Dr. Sumaya had it decorated with lights and formal dinner, and it was just such a celebratory event. And he was just so proud of what he'd done. And we realized at the time that we believe it was the only school of public health that had its own building that was built specially to be a school. And Dr. Sumaya has brought so much to that school based on his rich experience at HRSA. And it was also one of the first schools that I recall that was focused on a specific health issue, really looking to serve the community as well as the good of public health.
Within 8 short years, the school was ranked as a top 25 graduate school of public health by U.S. News and World Report. To underscore this accomplishment, it should be noted that the average age of the schools ranked higher than Texas A&M at the time was 40 years.
Dr. Sumaya had a bit of a combination of evangelist and Pied Piper in him. We followed him, and we did so because we knew that his heart and his expertise was in the right place. And so I think that's one of the things that the quality of his programs, the quality of the school, the professionalism of those people that he was bringing in from other areas to get those various departments started it was prestigious, and Dr. Sumaya had a national recognition, and he brought that to A&M.
Today, the school impacts through public health interventions and/or research in all 254 counties in Texas. It has international partnerships on 4 continents and is conducting research through competitive grants from NIH, CDC, NSF, HRSA, private foundations, and others.
You know, I'm really delighted to be here tonight to recognize all the accomplishments of Dr. Sumaya. He really is a founding father in this field, and as the third dean of the school, I am just delighted to come into a place that has such a strong foundation. You've heard the term standing on the shoulders of giants, and that's really what I get to do. The work that he did 20 years ago to bring this school together out of nothing. You know, he came from HRSA, from this incredible job, to Texas A&M where there was nothing there, and really through his intelligence, his wit, his ability to kind of work across sectors, he brought faculty together. He was able to recruit some of the best people in the country at the time, really through creative means. One of our senior faculty now, Marcia Ori, her husband Raymond Carroll was at A&M, and she was at the National Institute of Aging. And Ciro saw that connection and was able to recruit her, and she's now one of the biggest grant-funded faculty at Texas A&M. So those kind of things really have driven the school, and you can see that the ideas and the culture that he brought with him. He always wanted the school to be accepting and welcoming of people across race and ethnicity and gender and socioeconomic status. And we see that today lived out in our school as we're one of the top 5 most ethnically diverse schools of public health in the nation and the most diverse school at Texas A&M. And I think it's the culture that he developed that lets that happen. And that's really an amazing place to work in.
I want to throw a bouquet to Texas A&M and to Dr. Sumaya for being brave enough to take on a task for a school of rural public health, which did not exist anywhere on the planet, and to bring it in as its own and to realize the potential and to start from practically nothing and to continue to build from one step to another step to another step to now being U.S. News and World Report, one of the best schools of public health in the nation.
Doctor Ciro Sumaya, doctor, profesor, administrador, decano. Felicidades y gracias. So Ciro, congratulations. What an awesome and deserving award. But as a Latino who has looked up to you and tried to follow in whatever way I could in your footsteps, and I know I speak for many, many others, thank you. Thank you for providing the leadership and the inspiration. And thank you for all you have done, because not only me and others who are in the audience and others who may be on this video along with me, there are young Latinos who will be inspired by the fact that Dr. Ciro Sumaya has won and has been recognized by the Texas A&M system with this public health award. So again, amigo, felicidades y muchas gracias.